And preparing for this to become a pandemic, and the priority for this country has always been slowing the spread. Today, health officials attributed the aggressive quarantine measures and travel restrictions here in the United States for slowing that spread. I want to bring in Dr. Drew Oliveira. He's the Senior Executive Medical Director at Regence BlueShield. Dr. Oliveira, I want to start first with a little bit of breaking news from the CDC this afternoon. We just got it in minutes ago that they are investigating the potential first case of community spread right here in the United States. This is a patient who did not have any relevant travel to places infected with the coronavirus and was not a known associate of anyone who had contracted the coronavirus. With the potential for community spread now in the United States, what do people in our region need to know?
Well, thank you for the opportunity. Coronavirus is spread through, as in any other respiratory virus, like a common cold. And this virus itself has been shown to be highly contagious. So we need to treat it that way and do the things that we normally would do in flu season and otherwise. Wash your hands. Don't cough on people. If you're ill, stay at home. Things like that to really clean your household surfaces on a regular basis. Really trying to reduce that risk of spreading the disease to others.
Our viewers have a lot of questions. We wanted to make sure to get some of them to you. One of our viewers wanted to know, what do the symptoms look like for coronavirus? You said it was like a common cold. What does that mean?
Well, it typically presents a lot like the flu. So it may have fever, symptoms of an upper respiratory illness, such as a cough or shortness of breath. Usually it's within about 14 days after exposure, if you have a known exposure. In the case that you mentioned, there was no known exposure. And what you watch for is any symptoms of getting worse, and worse being shortness of breath and otherwise. If you start having these symptoms and you have a known contact or had recently traveled to one of those countries, I would ask you to call your physician's office rather than going into the office and potentially infecting others. And they will advise you on sort of either how to get seen, how to get care, how to get treated.
Do those more minor symptoms make it more difficult to contain a virus like this? Because, as you had said, common cold or flu-like symptoms, this is the exact time of year where we're experiencing that type of stuff. So if someone suspects that they have a cold or maybe coming down with the flu, is there a chance that it could be worse? And do they need to take even more extra precautions than they normally would?
Well, at this point, given that there is a low incidence of coronavirus in the U.S., as mentioned, 60 cases across the country versus the flu, where we have 15 million cases across the country. It's more likely to be, a more common illness. Now, if you have a risk factor, you've traveled or been exposed, healthcare worker exposed, then that clearly puts you at a different risk. If you're not sure, it's okay to ask, and I think you would ask your provider.
Do we have any treatments that we know of right now? I know that national health officials are working on a vaccine that's at least a year away, they said today. Are there any treatments in the meantime?
They're studying one of the HIV medications, which is an antiretroviral medication. It's being tested, but it's not a proven treatment. It's just one of the ones that may potentially work on this. Otherwise, the treatment is supportive to help the person through the illness, which happened with a person in Snohomish County. Didn't really need any additional treatment. It's essentially what we would do with other folks that may have a respiratory illness that has some complications to it.
Well, we know the risk is low right now, but it's great for people to be informed, and we really appreciate you taking the time, Dr. Oliveira, to inform our viewers and to give us a little bit more information on this virus and what we can expect. Thank you so much for joining us.
You're welcome.
And that's an important thing, too. We have so much information on our website for people. If it comes to